everyone. Welcome to Regenerate You. I'm Dr. Nirvana. I have a very special guest with me whose name is Amy Hamilton. Hi, Amy. Amy is a medical intuitive, and I'm super excited for her to join us because this is going to be the start of a new series in Regenerate You, but we're going to be doing this together, and it's going to be called Intuitive Healing. And it's all going to be about what Amy sees in terms of medically and spiritually going on in a person's body when they are dealing with hormone issues, with viruses, with gut issues, whatever it may be, some sort of ailment in the body. And then we will offer holistic alternatives to heal it, our experiences, both of our experiences, and how we see things. And it's another light on what really healing and going to the root issue is about. So welcome, Amy. I'm so excited to have you.
Oh, I'm so excited to be here. It's been so wonderful knowing you for a long time and working with just so many of your wonderful clients.
Thank you so much. I know a lot of them have gotten a great benefit. I've learned a lot from you myself, personally speaking, as well as professionally speaking, because I've learned a lot about what you see with patients, which is sometimes it could be so simple, but it's so fascinating on how ailments in our body are affecting us in so many different ways. And I thought it would be great, if you don't mind, for us to discuss something that I think both you and I have been experiencing, especially in our patient demographic and in the world, of course, and that's COVID.
Yeah, absolutely. Absolutely. We've definitely been seeing how that can affect, I can see how it affects people's bodies and beings. And it's just been so wonderful working with you because you actually have the tools and a lot of the resources and knowledge to be able to do that type of healing.
I think we're both super lucky to have one another.
Yeah.
Let's see what we can share with everyone else. Can you share what you see physically, spiritually, emotionally, whatever it may be, intuitively in a person's body when they actually get COVID?
Right. Oh, absolutely. Okay. So when someone gets COVID, when the COVID molecule has entered someone's body, the way that I've seen it from the very early stages is this erratic way that it moves through someone's just sort of being, which is why I feel, or why I've seen that people have these seemingly bizarre different reactions. So when it flows through someone's body, that spike protein that we've learned about, but from very early, I felt like it was going in and, my non-technical way of looking at it, just like poking random places. And unfortunately, those spikes are just more detrimental in certain areas. So if it enters and it goes into different parts of the brain area, or the nasal passages, or those type of nerve endings, it's where it's like creating these little random holes, and that is what's causing this, wherever it attacks and wherever it situates in the body, where it's causing some of those issues. Now, why does it sometimes go in? You lose your taste and smell, and sometimes it's in neuropathic pain, there's all these different, or it's in the chest. I tend to see that someone's overall weakness is where it can hit the most. So if you are someone that always gets challenges in your chest or in your heart, and you have unhealed heart pain or unhealed heart trauma, that might be where this is settling. Or if you're always very sensitive to smells or things are coming in, it kind of targets where you're most sensitive and where your kind of go-to of when you get sick, where your body is.
So if I could ask you this question, which I thought was interesting, I was just speaking to a patient of mine who has Hashimoto's. And we had all of her symptoms under control, and then she got COVID, and she noticed all of her symptoms that she used to have with Hashimoto's, because she was in remission, were now starting to, come back again after COVID. So from my interpretation of what you're saying and what I know from the past is it's gonna go to her thyroid because that's where she's most susceptible. Is that correct?
Absolutely. And then historically, you go back, why is someone's thyroid causing them issues? And I'm not going into your patients specifically, but a lot of times people have thyroid because they haven't said their piece, whether they've had generational trauma with their parents, if they have a problem with their husband or something like that, where they're not really speaking up, that can be where that sits. So it kind of goes back to what's the origin? Is it in a is it a health related thing? Is it emotional? Is it past life and things like that? But absolutely, I actually, it's very interesting. I have a client as well, Hashimoto's tendencies, and it got much worse after COVID. So again, it's just where that weakness is in your body. This unfortunately is it's very strong with attacking that. So I can't wait, because I know that you're really good with preventative. And I think that that's our best measure, is to strengthen the body as much as possible to heal that. And then once afterwards, we can talk more about that. So yeah.
Sure, absolutely. So here's the thing. You once told me about COVID, which I thought was fascinating, was that when in terms of like the tools and what we have to help heal it, is that once it creates that spike protein, there's different nutrients that can do one thing and another. Can you share with everyone what that is?
So my go-to now, I love working with you and great doctors, because you can explain. I am absolutely not a medical doctor, not trained. And so the way that I see things is from, I feel like, such a rudimentary level, and I can translate it to you. So when when that cell is sort of injured, what you'll need is something to fill in those injuries till the cell can heal itself. So what I was getting, and it's so funny because you had me get it for something, is like, I actually have it here, probably no surprise, but just like a glutathione. And I really like that glutathione with the vitamin C, because I feel like it's not a quick fix. It's not like you can cement it in, but slowly your body can heal using the right nutrients and vitamins, because it's not there's sometimes people are really good and their bodies jump back really quickly, but that's why I believe that we're seeing, with people who have autoimmune disorders, people who their cells aren't able to bounce back and get back in the game really quickly, is why it takes so long, and you're having some of those long haul COVID challenges.
And what we've found, medically speaking, is that it's really, really going inside the mitochondria. So as you know, our mitochondria is the powerhouse of each and every cell. So when that mitochondria is deflated, if you will, or affected, or it's preventing, it's being prevented in terms of what it wants to do, it needs to do, it can do. So almost like there's you've got the bicycles, what are they called? The bicycle spokes?
Yeah.
And then you put a stick in it, right? So that stick is what COVID is in the mitochondria, in that wheel, and it cannot function anymore. And that's where hair loss comes into play. Loss of energy comes to play. So long haul COVID, it's all because of the mitochondria being damaged. And I think one of the things you had said that I thought was so interesting about glutathione and how it works is, correct me if I'm wrong, that glutathione actually goes and is the glue of where the spike protein made the hole.
Yeah, that's what it kind of feels like.
Yeah.
That's what it kind of feels like to me. And then maybe it's that mitochondria that can kind of heal and regenerate, because it's our bodies are amazingly powerful and we can heal that way. But sometimes it's just a kind of a big assault. And I do feel like COVID is a big assault onto someone's system.
Amazing, amazing information. I love it. We could talk for hours and days on what to do. So that being said, what can we do? I know I think preventatively speaking, making sure that our gut is in check is absolutely essential. Of course, our immune system, and there are the go-to staples that the majority of people know about, which are your vitamin A, vitamin C, zinc, all of these wonderful antioxidants, C glutathione if we can. And for people that don't know what glutathione is, it's a very powerful antioxidant that our body already regenerates or makes. And it's wonderful for feeding the brain, which is why it helps to wake up the brain. It's great for liver detox. It feeds our thyroid, which is, I mean, of course, essentially everybody needs it, but it gets depleted in our body, right? And the number one place that actually utilizes it the most, which I don't think a lot of people know this, is the lungs. And so that's why a lot of people that have any sort of respiratory issues with COVID, the number one thing I tell them is to get some glutathione. I mean, obviously from their physician or a compounding pharmacy, if you will, that's injectable. And you can actually take some of that and put it in a nebulizer and inhale that, and that will immediately start to heal the lungs. So that will be very, very beneficial. But also, I think that's where the vitamin C IV therapies, if you have anybody near you, close by you, to get a vitamin C and glutathione IV to prevent getting sick, but then if you do get sick, you'll get better a lot sooner. And it really prevents the long haul COVID. And just going to the mitochondria, making sure that the mitochondria stays as healthy as possible. CoQ10 is fantastic for that. Glutathione is fantastic for that. And lastly, I would say the gut health, because I've seen so many people, unfortunately, where as soon as they get any sort of viral, anything, whether, you know, they're getting the norovirus from a cruise ship or what have you, it'll go to the gut. And then that's where our, you know, our diarrhea comes into play, or our nausea and vomiting, or what have you. So making sure that the inner lining of the gut is healed and stays healed and protected is really important. So we can definitely put all this information in terms of products at the bottom of our intro or what have you. But is there anything else that you think is extra special on what you see spiritually going on with the body?
So again, you know, we talked, emotionally, it is a lot, you know, where, like we talked about earlier, that someone went, their go-to was the thyroid because of probably some challenges in speaking their voice, having challenges like that. But spiritually, there is just a lot of fear. And, you know, I always say you don't have to be a psychic to do, you know, to know that, or a medical intuitive. There's just a lot of fear associated with COVID. So even someone who is an educated physician, someone who works in this space a lot, when you get that diagnosis, it's very scary. And when we get to places of fear, our immune system suppresses because we just cringe in and it just kind of shut down. So what I do find is if you can do things that will relax you. Now, I sometimes suggest meditation, but like, oh my goodness, quiet listening to nothingness for 5 minutes can be the opposite of many of our busy minds, right? So know what quiets you. If it's looking at a body of water, play a nice video. If it's going outside and just walking in the grass, or if it's gardening, or if it's just being outside, something that is centering and brings you back. Sometimes it can be even watching a religious show or something like that. But whatever you can do to support yourself emotionally, because that fear is real, and the fear puts you into a lot of times this fight or flight place in our brain, which is very hard to get to healing there when you're there. So that support your system in its place of fear is, I think, really, really important.
Do you see the cells almost going from like an excited, frantic state to literally calming down when something like that happens? I mean, energetically, do you see something physically changing in the body?
What I'll see is like when I see this fight or flight take, it's like we get so I have my own like go-tos, what it means in my brain. So when I see that, it just feels like you know, that place, oh my gosh, I've had enough. I can't take anymore. I'm going to freak out. Like, that's what it kind of feels like. And when you're in that place, there's no good decision making that's happening. I mean, we've all been there. Everyone has that moment where they're just, you know, rationality is out the window. And so if you're able to if you're able to bring that and be able to take those deep breaths rather than I'm shallow breathing in, I'm really scared, you know, if you're able to just bring that down, it's not like meditating is going to cure COVID, but it's going to let the other health things that you're working through, it's going to let your body kind of relax into, you're going to be okay. We're going through a process. The medicine's out there. We've got the right supports and you are protected. Mm-hmm. And once you get to that, it just is such an easier way to heal.
Easier, gosh, yes, easier. What about, I think there's one other nutrient that's very much talked about, which is an actual hormone that's been so incredibly beneficial for COVID healing and prevention. And the reason I want to bring it up is because I don't think people realize the benefits of being outdoors in the sun and how vitamin D is so incredibly helpful. Medically speaking, I know it's because it's working on the mitochondria. And that mitochondria, like I said, once the engine stops, every cell will stop and it can't perform its optimal functions. But can you see the why of that? Why is D, energetically speaking?
Energetically, I mean, we get the best way to get vitamin D, but we can't all absorb it, is to be out in the sun and feeling that sunlight and feeling, you know, wherever you feel, is that source coming in? Is that God coming in? Wherever you feel like that calming, unbelievably good feeling is just so centering, right? It's kind of like what I was talking about. But the flip side is, oh, if you're out in the sun too much, you're going to get cancer, you know, like all of these things. So, but I do believe that is that healing energy from, you know, just the world that actually pulls in. And so, you know, if you can imagine just being out, just feeling that sun's rays on you, it's just such a comforting and calming place for the majority of us. So I think that the way that I spiritually see that is how the vitamin D is actually doing the same thing.
So it becomes more of a calming effect on the body, the actual vitamin D.
It's a calming, but it's also a healing. If you think, I mean, if we go down the road, this is source, this is, you know, our creator's energy coming in. I mean, that's just a really beautiful way, I think, of thinking about what vitamin D does in our systems.
And it makes me think too that, you know, there's only so much benefit from supplements. Well, I love supplements and they're there for a reason, because not all of us can get outdoors or what have you. It's knowing that, yes, vitamin D, one of the best sources is from the sun. Of course, there's salmon and there's eggs and things of that sort as well. It's not just the fact that it's D. It's the fact that it came from some form of life, if you will, that carries an energetic healing aspect to it. So if you almost kind of strip the D away from that, it's not as healing as being outside.
Yeah, that's definitely the way that I see it. I'll probably go back and like cut that little piece and remember that, because that was a beautiful way of saying it.
Thank you. Thank you. That's so helpful.
Well, thank you for having me here today. I love this series. I mean, I especially love being able to marry what I see with what actually is rooted in medical, you know, in medical knowledge. So I just think it's really just a beautiful, beautiful combination.
It really is. And it's another wonderful, beautiful tool that I'm hoping that we can share with so many people, because I know we've had a lot of great discussions about so many aspects of health, whether it's eating disorders or just anxiety or
Yeah.
PTSD, and we've seen how it's related physically in the body, and how we've worked together to help heal it and with the people that we're trying to help. So I'm anxious to get all this information out there.
Absolutely. Absolutely. Well, I'm looking forward to the next one. We'll see you guys all there.
All righty. Thank you so much, Amy. And stay tuned, everyone. We'll get to see what Amy has to share with us very soon. I will put some more information about all the information and the supplements, of course, that we discussed. But I think our takeaway is get outside, be in nature, love your body as much as possible, and listen to what's going on in the inside. Because I think if we can stop the stress from the beginning, that stress makes us more susceptible to bacteria, viruses, etc. So yeah, it is really about calming ourselves and being in nature as much as we possibly can. So until next time, we'll talk soon. Bye, Amy. Thank you.
Bye.
Bye-bye.